Your doctor says everything looks great. Your blood sugar is perfect at 92, but you're still struggling with stubborn belly fat, crashing after lunch, and feeling like your metabolism is broken and you can't lose weight. Here's the scary truth. You could already have insulin resistance, and neither you nor your doctor would know it just by looking at your blood sugar. We call this metabolic dysfunction. Metabolic dysfunction starts years before diabetes shows up on standard tests. Here's what's happening. Insulin's job is to move sugar from your blood into your cells so they can use it for energy. But something will happen where your cells become less responsive to the insulin signals. And there can be many reasons for this. Diet, stress, weight gain are some of the major causes. But your pancreas compensates by producing 2 to 3 to even 5 times the normal amount of insulin so that your cells can recognize the signals, and insulin can do its job and lower blood sugars to where it is normal since you can still make it. You may even have low blood sugar episodes because your insulin levels will be much higher, so it will drop your sugars lower. But high insulin levels can come at a cost. It's like having to speak louder and louder to get someone's attention. Eventually, you exhaust yourself. When your pancreas can't keep up anymore and has to keep trying to make more and more insulin so that the cells can hear it, then it burns out and you'll start seeing your blood sugars rise to about 100 and then higher, and you'll be in the pre-diabetic range and then the diabetic range. So when your insulin levels are chronically high, it can cause some health issues. It can turn you into a fat storage machine, and especially it likes to store fat around the midsection. That's why a lot of people who are insulin resistant will have waist measurements over 35 inches for women and over 40 for men, or a waist to hip ratio greater than 0.85 for women and greater than 0.9 for men. Insulin can also trigger inflammation in your body, causing disruption in your hormones, causing other chronic diseases such as heart disease, osteoporosis, dementia, PCOS, and even cancer. Here are some signs of insulin resistance that I see in my practice. Hypoglycemia, where you have low blood sugars, especially 1 to 2 hours after eating, especially if there are processed carbs in that meal. Signs of hormone disruptions such as PCOS, irregular cycles, fertility struggles. You might have fatty liver. If you have fatty liver, you usually have insulin resistance. Brain fog after meals, and skin tags. Your doctor can check a fasting insulin, and the lab range is different than what's optimal. In the functional medicine community, it varies a little bit. Some say under 7, that's what I use. There are some that even say under 5, and there are longevity experts that even say under 3 is preferred. If your doctor won't order a fasting insulin level, look at your triglyceride to HDL. HDL is your good cholesterol, but you can look at that ratio, and if it's over 2, then you could be insulin resistant. That leads me to today's daily habit challenge, and that is to eat protein first at your meals. There are 2 reasons for this. Protein acts like a metabolic brake, slowing down your glucose absorption and keeping your energy steady. Number 1 is protein helps absorb the glucose load if you happen to be eating any carbs, especially processed carbs in your meal. If you eat the protein first, this blunts that huge insulin spike you might get if you eat carbs first. Number 2 is protein stimulates GLP-1, and you may have heard of GLP-1s with these weight loss medicines, but you can increase it naturally, and that helps keep you full at meals, so it can aid in weight loss. GLP-1 is a satiety hormone, so it tells your brain that it's full and curbs your appetite. This is a simple tip that you can do. Please leave a comment if you are enjoying these daily habits, and let me know what your health habits are. Maybe there's something you're doing that you found helpful. Let's all share so we can help each other. If you're watching the podcast version, please leave a review. That helps other people discover my podcast, and they can benefit from these daily habits and functional medicine topics too. Please follow, subscribe. Thanks for listening or watching, and have a fantastic day.